Hello. Today I'd like to take you through a basic knee examination so that you can feel empowered the next time you visit your clinician to address any knee pain. With a basic knee exam, your clinician should first rule out more serious causes of knee pain. These include any accident or injury occurring to the knee that results in an inability to fully straighten the knee. If you're unable to straighten your knee, you could have experienced a quadriceps or patellar tendon rupture, and a clinician can feel around the knee for any indent that might clue them in to this condition. If you're unable to extend the knee because you feel a locking or catching sensation, this could be due to a loose bony fragment within the joint. People who are more at risk to fracture the knee are usually over the age of 50 or under the age of 12, and they're usually unable to take more than 4 steps on the injured leg. After these more serious conditions have been ruled out, a clinician should proceed with a screening of the low back. The low back can often refer pain into the knee, tricking people into thinking that they have an issue at the knee when it's actually pain that's coming from the low back. Your clinician should screen the low back by having you arch back and look over each shoulder and asking the question, does the knee pain feel better, worse, or the same? They should ask the same question as you bend forward. If any of these spinal motions change your knee pain, it's likely that that pain is actually coming from the low back. If the low back has been ruled out, a clinician can proceed with the basic knee examination. This is divided into 2 common categories: knee pain that occurs after an injury and knee pain that arises without any injury whatsoever. First, we're going to talk about the knee pain that occurs after an injury. If you have an injury to your knee, you hear a loud pop, and there's an immediate large amount of swelling that makes your knee look like a cantaloupe, that's likely an ACL rupture. On the other hand, if you have an injury to your knee and you have a moderate amount of swelling over the next 1 or 2 days, that could be a sprain to your MCL or your LCL, or it could be a meniscus tear. If it's a meniscus tear, it's going to hurt if you plant your foot and twist on the affected knee. This is called a Thessaly test, and it's very painful with a meniscus tear. Those are the more common injuries that can occur at the knee. Now we're going to look at the category of knee pain that arises without any injury whatsoever. If you're in this category and you're a younger person, you're probably dealing with patellofemoral pain syndrome or a strain to the surrounding musculature. Both of these conditions usually occur with any overuse to the knee. Now, if you're an older person and you're having a flare of knee pain without any injury, you're likely dealing with arthritis. This typically feels like a toothache within the joint. It's worse in the morning, it's worse with cold weather. The pain can last for up to 15 days, and it can cause a limp. So if you haven't had an injury to your knee and you're somebody who's a bit younger, it's probably patellofemoral pain syndrome or a strain to the surrounding musculature. If you're a bit older and you feel a toothache within the joint, that could be a flare of arthritis. The good news is that many of these conditions are easily treatable with conservative care, and they should respond to my protocol, the knee pain solution. However, you need to consult your clinician before starting any rehab program. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.